Hi, your provider has prescribed Xeloda for you, also known as capecitabine. Our pharmacy team has prepared a 7-minute presentation which will go through the important things to consider while taking this medication. Here is our table of contents. We'll start by going over general chemotherapy precautions, and then we will discuss concerns specific to the medication you will be taking. What is oral chemotherapy? Oral chemotherapy is cancer treatment you take by mouth, in pills or liquid. It is just as strong as other types of chemotherapy, such as an injection. How do you handle oral chemotherapy medications? Keep chemotherapy away from pets or children. If a child, pet, or other family member accidentally takes your oral chemo, call the National Poison Control Center. Pregnant women should avoid handling chemotherapy or cleaning up after a person taking chemotherapy, including cleaning the bathroom and laundry. Wash your hands with soap and water before and after you take oral chemotherapy. Do not break, split, open, or crush the tablets or capsules, and keep these medications away from places where you handle food. How to store oral chemotherapy medications. Keep any oral chemotherapy medicine in its original container, separate from other medicines. That includes using a separate pill organizer for chemotherapy. Store your chemo at room temperature, away from heat, moisture, and direct sun, and ask your doctor or pharmacist if you should keep any medications in the refrigerator. And of course, if you do, keep them away from children. How to clean up oral chemotherapy medications and waste. Wear disposable gloves. This includes cleaning areas where body waste goes, such as the bathroom and doing laundry. Avoid touching your urine, vomit, or bowel movements while taking oral chemotherapy. If you get some on you, wash it off with soap and water. You can use the same toilet as other people who live with you. Ask your doctor or nurse if you should flush twice after using the toilet. Wash your hands with soap and water after using the toilet. Wash sweat off your skin. Wash your bed sheets, towels, and clothing separately from other laundry. What if you have extra medication? Take any extra medicine back to your pharmacy or doctor's office. At the UNM Cancer Center, we have a special green bin to dispose of unwanted medication. Do not put it in the trash, sink, or toilet. What if oral chemotherapy does not work well? Make sure to take your oral chemotherapy exactly how your doctor or nurse tells you in order to give it the best chance of working. If the oral chemotherapy does not slow down or stop your cancer, your doctor will talk with you about other treatment options. If you feel you need to stop oral chemotherapy, be sure to call a doctor or nurse first. Oral chemotherapy can cause side effects just like other chemo can. We have some of the major side effects for all chemotherapies listed here, but there are many others that are possible. Call your nurse right away if you have any questions or concerns. Waiting even 1 to 2 days can be dangerous. Capecitabine is the generic name for Xeloda. It is an anti-cancer chemotherapy drug. It is used for multiple different types of cancer, some of which are on the screen here. Capecitabine is taken as a pill by mouth. Take capecitabine after food within 30 minutes of a meal with water. Usually, capecitabine is taken as a divided dose 12 hours apart. Tablets come in 2 sizes, 150 milligrams and 500 milligrams. Your doctor will tell you your dosage and schedule. Do not crush, chew, or dissolve the tablets, and if you miss a dose, skip the missed dose and go back to your normal time. Do not take 2 doses at the same time or extra doses. The important things to remember about the side effects of capecitabine is most people will not experience all of the side effects listed. The side effects are often predictable in terms of their duration and severity. Capecitabine side effects will improve after therapy is complete, and capecitabine side effects may be quite manageable. There are many options to minimize or prevent the side effects of capecitabine. The common side effects of capecitabine are low white blood cell count, low red blood cell count, and hand-foot syndrome. Hand-foot syndrome is a skin rash, swelling, redness, pain, and or peeling of the skin of the palms and soles of the feet. It's usually mild. It can start as early as 2 weeks after the start of treatment. It may require dose reductions. Be sure to talk to your doctor if you experience any of these symptoms. Diarrhea is also common, as well as elevated liver enzymes, fatigue, nausea and vomiting, rash and itching, and abdominal pain. Here are some of the less common side effects of capecitabine. I'll give you a minute to read them yourself. Contact your healthcare provider immediately, day or night, if you experience a fever of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, or chills, which are possible signs of infection. Contact your healthcare provider within 24 hours of noticing any of the following symptoms: nausea that interferes with your ability to eat and unrelieved with your prescribed medications, vomiting more than 4 to 5 times in a 24-hour period, diarrhea more than 4 to 6 episodes in a 24-hour period, unusual bleeding or bruising, including black or tarry stools or blood in your stool or urine, constipation, extreme fatigue, mouth sores, swelling, redness, and or pain in a leg or arm, yellowing of the skin or eyes, tingling or burning, redness, swelling of the palms, hands, or feet, and confusion, loss of balance, or excessive sleepiness. Before starting capecitabine treatment, make sure you tell your doctor about any other medications you're taking, including prescriptions, over-the-counter medications, vitamins, herbal remedies, or anything else. Do not take aspirin or products containing aspirin unless your doctor specifically gives you the okay. Avoid the use of antacids within 2 hours of taking capecitabine. If you're on warfarin or Coumadin as a blood thinner, adjustments may need to be made to your dose. Capecitabine may be inadvisable if you have had a hypersensitivity or allergic reaction to fluorouracil. Do not receive any immunizations or vaccines without your doctor's approval. Inform your healthcare professional if you are pregnant or may become pregnant prior to starting this treatment. Do not become pregnant while taking capecitabine. For both men and women, use barrier methods of contraception, such as a condom. Discuss with your doctor when you safely may become pregnant or conceive a child after therapy. Do not breastfeed while taking capecitabine. Drink at least 8 to 12 cups of water every 24 hours unless you're instructed otherwise. You may be at risk of infection, so try to avoid crowds or people with colds. Wash your hands often. To help treat or prevent mouth sores, use a toothbrush and rinse 3 times a day with 1.5 to 1 teaspoon of baking soda and or 1.5 to 1 teaspoon of salt mixed with water. Use an electric razor and soft toothbrush to minimize bleeding. Avoid contact sports or activities that could cause injury. To reduce nausea, take anti-nausea medications and eat small, frequent meals. Prevention of hand-foot syndrome includes modification of normal activities of daily living to reduce friction and heat exposure to hands and feet as much as possible. Keep the palms of your hands and soles of your feet moist using emollients. Follow a regimen of anti-diarrhea medication if necessary. Eat foods that may help reduce diarrhea. Avoid sun exposure. Wear SPF 30 or higher sunblock and protective clothing. You may experience drowsiness or dizziness. Avoid driving or engaging in tasks that require alertness until you know how you will respond to the drug. In general, drinking alcoholic beverages should be kept to a minimum. You should discuss this with your doctor. Get plenty of rest, maintain good nutrition, and if you experience any side effects, make sure to let your doctor know right away. You will be checked regularly by your doctor while taking capecitabine to monitor side effects and to check your response to therapy. Periodic blood work to monitor your complete blood count as well as the function of other organs such as your kidneys and liver will also be ordered by your doctor. That concludes our presentation. Be sure to stop by the pharmacy if you have any other questions.